Here at Regional Medical Center of San Jose, right now they have 90 COVID patients, and they had to bring in additional staff to handle the surge. Governor Gavin Newsom says California is in the worst COVID surge since the beginning of the pandemic, with an average of 163 people dying every day during the past week. So many deaths, the state has now activated its mass fatality program.
We just had to order 5,000 additional body bags they just purchased for the state.
In the Bay Area, hospital ICU beds are filling up fast. As of this morning, there were just 35 ICU beds left in all of Santa Clara County. But it's the staffing shortage that is the biggest concern. Today, Governor Newsom outlined what the state is doing to address the problem.
We are actually looking overseas, interestingly, to potentially recruit some staffing.
He says the state has already added 80 additional paramedics and EMTs, 50 National Guard members, and asked the Department of Defense to provide an additional 200 healthcare workers. The state is also making changes to get quarantine nurses and doctors back to work sooner.
During our critical staffing shortages, we now have looked to a 7, not a 10-day quarantine for healthcare workers and emergency response workers, social service workers that have been exposed, but as long as they test negative on day 5 or later.
In addition, here in the Bay Area, special centers are preparing to open to handle patients who were not acutely ill, including here at the Craneway Pavilion in Richmond, which is preparing 250 beds. The good news is today the governor said that the state has plenty of ventilators and personal protective equipment. In San Jose, Marianne Favro, NBC Bay Area News.